as we continue to provide an update on the global, regional, and national situation in relation to the COVID-19 pandemic. Ladies and gentlemen, as of the 27th of March 2020, the updates are as follows. The number of confirmed cases globally stands at 468,111, with the number of deaths at 19,769. In the region of the Americas, the total number of confirmed cases has increased from 70,877 to 81,139, with the number of deaths moving from 977 in 48 of the 55 countries to 1,176. Allow me now to apprise you of the Guyana situation as of yesterday, 26th of March 2020. The number of positive cases in Guyana remains at 5, with 1 death, and the total number of persons who have been tested moved from 26 to 39. Of the 5 persons who have been tested with their results positive, 3 would have been imported cases and 2 local. Let me clarify on the difference between imported cases and local cases. Imported cases refer to those persons who became infected and traveled to Guyana. On the other hand, local cases are those persons who were infected in Guyana. We do have a number of persons quarantined by the Ministry of Public Health. Under institutional quarantine, the number remains at 31, while those on home quarantine remains at 135. At present, our surveillance team is monitoring another 14 persons. 4 persons remain in institutional isolation by the Ministry of Public Health. Let me assure you that psychosocial support continues as planned for those persons who need these services. With regard to our capacity to respond, we currently have 4 facilities ready to provide services for 350 persons, while our regions have already begun to identify and prepare quarantine facilities. As of yesterday, calls to the COVID-19 hotline moved from 696 to 773 calls. These calls were received from 9 of the 10 administrative regions. On a brighter note, I am happy to announce that the Ministry of Public Health has received an additional 1,100 test kits today from PAHO WHO, thus bringing the total number of donated kits to 1,800. We have also received 14 ventilators from our suppliers to boost the capacity of our level 3 facility. Members of the media, fellow Guyanese, I wish to compliment the regional and health authorities of the Patara Superuni region for the work they're doing on COVID-19, and the villages of Subregion 1, namely Kopinang, Tusaning, Kanapang, Chiang Maut, Kaiburapai, and Waipa, for the initiative taken in their various communities that border Guyana to Brazil. A logbook is now in place to record all visitors, name, contact info, travel history, medical background, destination, etc. This will enable them to monitor travel, which will allow for early reporting and timely response to any COVID-19 situation. Congratulations. Further, I wish to comment on the situation that pertains in the region of the Americas, where the number of COVID-19 positive cases is increasing at an alarming pace. In the United States of America, we do recognize that there is a rapid spread of COVID-19, and I'm sure that we all are concerned for the state of well-being of our loved ones over there. Let us all learn from their experience and ensure that we adhere to the several preventative measures, which include social distancing, hand washing, and cough etiquette. I now wish to address some of the concerns that were raised on social media platforms. Firstly, let me remind the public that only the National Public Health Reference Laboratory of the Ministry of Public Health is equipped and certified to conduct COVID-19 testing. In response to questions regarding the drug used to treat COVID-19 positive cases, please be advised that to date, WHO has not identified a specific drug that can be used to treat these persons. Please note, however, that persons who have contracted the coronavirus disease will continue to be treated based on any symptoms that may be present. Regarding the calls for investigation into the disclosure of information from the quarantine site, I make an appeal to you who are residing presently at our sites to please recognize the sensitivity of this situation and to desist from this practice. We would like to continue to provide you with free internet access. However, if this continues, we will be forced to take action.